Tu podcast w głowie się mieści. Probably with my next questions, maybe not only one, because one is about, in your opinion, what is the heart of CBT? Like we've been talking about the concept, cognitive conceptualization. So this is what for me comes to my mind. And what are the key skills of a CBT therapist? So it's a good bridge to that question, I think.
So the cognitive conceptualization is extremely important. So therapists need to ask clients questions perhaps about an upsetting situation in the previous week, or something that something that might be coming up in the next week, and then find out what specifically was that situation. What were the patient's automatic thoughts? How did the patient then feel? What did the patient do? Especially if it's an anxiety patient or a medical patient, did the patient have certain physiological reaction? And then it's important to figure out what are some of the themes that we hear in this particular patient's automatic thoughts over and over and over again, because those themes are related to the basic way, the core beliefs that the patient has about himself, his world, and other people, and the future. Then we want to understand how it is that the patient developed these beliefs, particularly if they're quite negative and long-standing. What happened when this patient was a child or a young adult, particularly? What were some of those experiences that they put a particular meaning to? And that meaning is really what their core beliefs are. And then how have they coped with these difficult core beliefs all their lives? So it's very important to figure out the conceptualization, both in the here and now, of things that are problematic for the patient today, and also what kind of the background is, why it is that patients are having these kinds of automatic thoughts. So cognitive conceptualization is absolutely key. The other element that's completely essential is having a good therapeutic relationship with the patient. Now, unfortunately, I don't know how it is in other countries, but in the United States, there are a number of therapists who believe that cognitive behavior therapy doesn't particularly value the therapeutic relationship. And to me, that's just ridiculous. If you don't have a good relationship with the client, why would the client even come back to the next session? Why would the client cooperate with you and collaborate with you? Why would the patient feel comfortable enough to tell you really the truth of what's going on and what her experiences are, and so forth? And there are a number of things that CBT therapists should do to develop a good relationship, and also to prevent problems from arising in the relationship. But CBT therapists also need to be very good at recognizing when there has been a rupture in the relationship, and then need to learn what to do about the rupture to heal the relationship so that the client will come back and will continue working with you. So I would say those two things are the most important. A third thing, which needs to be different sometimes for different patients, like if we're dealing with patients who have been hospitalized for 30 years, it would be very different from if I'm seeing a depressed patient in my office who's only been depressed for a few months. But particularly with outpatients, the structure of the session is important, only because it's the most efficient way of getting things done. And so there are a number of things we want to do in the beginning of the session. We do a mood check. We want to find out what's important that happened between last session and this session. We want to ask for positive things too, and help patients draw positive conclusions about those experiences. We want to set an agenda. We want to know what problem or goal the patient wants to address in the the coming session, for the rest of the session. And we want to find out what the client was able to do in terms of self-help assignments or action plans between sessions. What did they learn from those experiences? Then in the middle of the session, we wanted to talk about a specific problem or goal. And we want to do a cognitive conceptualization about that. We want to figure out where to start working on this with the client. Do we need to do some problem solving at the situation level? Do we need to address the automatic thoughts the patient is having? Do we need to teach the patient emotion regulation skills? Does the patient need behavioral skills training? Does the patient need to know how to cope with anxious sensations that they're catastrophizing about in their body? So we do a cognitive conceptualization. Collaboratively, we decide with the patient where to start working. We might work at one of those levels or all of those levels or someplace in between. And then before we move on to another problem or goal, we ask the patient, what do you want to remember that we just talked about? And we want to make sure that anything that's important for the client to remember is written down so the client can read these therapy notes every day. And if the client hasn't already said it, it's also important to say, what do you want to do about this problem or do toward this goal this week? And then how likely are you to read these therapy notes? How likely are you to do this behavior that we've just collaboratively decided that you're going to do? And if it's client says less than 90%, then we either have to change the assignment so it's easier or make it optional or find out what's going to get in the way. Usually there's some practical problem that might get in the way, or the patient has some automatic thoughts that might get in the way. What's also really important at the end of the session is to ask for feedback. What did you think about today's session? At the beginning of treatment, we probably will also ask in the first few sessions, was there anything that bothered you or anything you thought I didn't understand? Is there anything you want to make sure and do differently next time? And it's so important to get feedback from patients. And the first thing that we say when patients give us negative feedback, either during the session or at the end of the session, we have to say, oh, it's good you told me that. And it is good, because if there's a problem, you need to know what it is so you can then collaboratively solve that problem.
You can also enhance the therapeutic relationship, that this is the open space when we can share also a difficult thoughts and the problems, but we want to solve them. So that's
exactly
as I understand it.